Assalamualaikum, warm welcome to all. Today we will talk about the anti-hyperlipidemic drugs. These are the drugs that decreases the lipid level in the blood. The lipid include the cholesterol, triglycerides. So if you're going to have high triglyceride and cholesterol level and low HDL level in the blood, the hyperlipidemic drugs is given to that particular patients in order to decrease the triglyceride and cholesterol level and increase the HDL level. Now what an HDL is? This is lipoprotein. Now what a lipoprotein is? Lipoproteins are basically the carriers of lipids. So today we will talk about all this mechanism in detail, as you can see in the diagram. We will start from the gut. Right, this is the gut. When a food particle is engulfed by the person, that food particle, if it has high level of cholesterol and free fatty acid, the bile acid that is present in the gut that enables the absorption of cholesterol and free fatty acid, and it absorbs the cholesterol and free fatty acid and pack that in a vesicle called as the chylomicron. So the chylomicron is a lipoprotein. It's a carrier of triglyceride and cholesterol. This is in the lymph, and chylomicron is formed by the gut. Over here I will mention an MCQs. The chylomicron is synthesized by the cholesterol and triglyceride absorbed from the gut, whereas the VLDL, which is also a lipoprotein and it also contains cholesterol and triglyceride, but it is synthesized by the liver. Right, so the difference in VLDL and the chylomicron is that both have cholesterol and triglyceride, but the chylomicron is synthesized by the gut, whereas the VLDL is synthesized by the liver. Okay, so once the chylomicron is formed, it will then enter into the circulatory system through thoracic duct. Right, okay, once it enters into the circulatory system, it will be acted upon by an enzyme called as the lipoprotein lipase. This enzyme will break down the triglyceride that is present in that chylomicron into free fatty acid. That free fatty acid in the adipose tissue will be stored in the form of triglycerides, while in the muscle it will generate ATP. The remaining chylomicron is called as the chylomicron remnant, and it will come onwards towards the liver, and there it will excrete its remaining triglyceride and cholesterol level and give it to the liver. In the liver, it will synthesize the VLDL. From the cholesterol and triglyceride, the VLDL will be synthesized. The VLDL will again be acted upon by the enzyme called lipoprotein lipase, and the triglyceride that is present in this VLDL will be converted into free fatty acid. So as the triglyceride is removed, now the remaining or you may say VLDL will be converted into LDL, and this LDL will now have low level of triglyceride as because it was removed by the enzyme lipoprotein lipase. What this LDL will do, it has affinity to bind organs like gonads, where it will synthesize steroidal hormones, because for the synthesis of steroidal hormones, cholesterol is essential. So the steroidal hormones, for example, progesterone, ergosterone, progesterone, and testosterone or aldosterone, it will be synthesized, right? But it's beneficial point. But where the disease or defect occurs, the defect occur when the LDL attaches with the macrophages, as because it also has greater affinity to bind with the macrophages and monocytes. So once it's bind with the macrophages and monocyte, as it has affinity for these cells, so the cholesterol and the triglyceride will be engulfed by the macrophages, and it will be converted into form cells. These form cells will accumulate and aggregate in an area leading to the formation of atherosclerotic plaque. This plaque is harmful for the body because it leads to hypertension, it leads to angina. So we are going to prevent the formation of atherosclerotic plaque by giving the hyperlipidemic drugs. Right, now what are those hyperlipidemic drugs? That drugs include the 3-hydroxymethylglutarallyl coenzyme A reductase inhibitor, the NIACIN, the ezetimibe, which is cholesterol absorption inhibitor, the bile acid sequestrant, and the last but not the least, the Fibrates. Starting from the 3-hydroxymethylglutarallyl coenzyme A reductase inhibitor. In the liver, what happened, there is acetate. In the acetate is converted into 3-hydroxymethylglutarallyl coenzyme A. This is converted into mevalonic acid, and in turn it is converted into cholesterol. So the cholesterol is synthesized from the acetate and through the enzyme reductase, 3-hydroxymethyl or HMG coenzyme A reductase, right? So if you're going to inhibit this enzyme, the 3-hydroxymethyl glutaraldehyde coenzyme A will not be converted into mevalonic acid, and in turn the cholesterol level in the liver will decrease. What happens when there is decreased cholesterol level in the liver? The liver will synthesize the receptors that will bring the LDL from the circulatory system into the liver and will pour the triglyceride and cholesterol into the liver. Furthermore, it will also lead to the decrease in the formation of VLDL because it has a low level of cholesterol, right? So in that way, where we decrease the LDL level in the circulatory system. So the main effect of this inhibitor is to decrease the LDL level by acting upon the enzyme HMG coenzyme A reductase, right? These drugs basically end with the word statin, like rosuvastatin. Okay, now we have the next one is the niacin. The niacin main function is on the adipose tissue. On adipose tissue, what happens? The triglyceride, which is in the stored form, it is converted into free fatty acid. That free fatty acid is then absorbed by the liver, right, in order to synthesize triglyceride, right? Okay. So triglyceride is converted into free fatty acid by the enzyme hormone sensitive lipase. So if you are going to inhibit this enzyme, the triglyceride will not be converted into free fatty acid, and the free fatty acid will not come onwards towards the liver, and the triglyceride level will fall. In turn, it will lead to decrease in the formation of VLDL and thus the LDL, right? So this is how they are going to drop the LDL level, right? Now both the niacin and the 3-hydroxymethyl glutaraldehyde coenzyme A reductase inhibitor, they basically decrease the LDL level. Now we have the fibrates. The fibrates main role is at dropping the triglyceride level, and how they do it fibrates work on the protein called the lipoprotein lipase, right? What the lipoprotein lipase do, it basically remove the triglyceride from the VLDL and the chylomicron and break them down into free fatty acid. Now if you are going to stimulate this activity, more of the triglyceride will be removed from the VLDL and the chylomicron, right? So there will be less synthesis of LDL, and there will be less less entrance of triglyceride into the liver, and thus in turn also there will be less synthesis of LDL. But here its main action is on the lipoprotein lipase, and in that way it decreases the triglyceride level, right? Okay, now we have a protein called as a protein ApoC3. This protein basically inhibit the function of this lipoprotein lipase. So if we are going to inhibit this protein, this will not act on this enzyme, and thus their function will also be stimulated, right? Okay, so this is how the fibrates work in order to decrease the triglyceride level. Now the next one is okay, we will come to HDL later. First we will discuss the ezetimibe, which is cholesterol absorption inhibitor, and the resins. What happens? The BAs, bile acid sequestrants. Normally this is if you can see over here, the bile acid which is in the gut, right, it is absorbed into the liver. The liver from cholesterol, also the bile acid is being synthesized, right? And the bile acid is then converted into bile. The bile contains phospholipid, cholesterol and bile acid. 80% of it is bile acid. It is then again through common hepatic duct stored in the gallbladder, and then through common hepatic duct it is poured into the duodenum, right, means the gut. So this is all the mechanism of the bile. It is absorbed and it is poured back into the duodenum, right? What happens if you are going to prevent the bile acid entrance into the liver? If bile acid is not coming into the liver, what will happen? There will be decreased synthesis of bile. If bile level is dropped, the cholesterol will first to synthesize the bile acid, and means its force towards the formation of bile acid will increase rather than moving in this direction and leading to the formation of LDL. So more of the bile will be produced from cholesterol, and in this way we are going to drop the V and the LDL level. All right, and how the bile acid sequestrant basically stop its entrance into the liver. The bile acid is negatively charged and the base is positively charged. It binds with the bile acid and excrete them in the urine, so, or in the feces, in the poop, sorry. So what happens? The BAS binds with the bile acid and it is excreted. So the cholesterol, triglyceride, phospholipid, bile acid, they are excreted in the poop, right? Okay. Now the other is ezetimibe, which is cholesterol absorption inhibitor, the only drug, and they are recommended to give it with the other drugs, right? They are ideal to give with the other drugs. So what they do, they act on the NPC1 receptor and inhibit the absorption of cholesterol into the liver. So if cholesterol is not absorbed into the liver, it will be excreted in the gut, and thus it will lead to the decrease in the synthesis of cholesterol, right? And clothrane AP2, it helps in the absorption of cholesterol into the liver. So okay, now coming onwards towards HDL. Why HDL, high level of HDL, is essential for the body? This HDL is basically synthesized from the liver and it is an empty shell. When it enters the circulatory system, it removes the plaque. How? By absorbing the cholesterol and triglyceride. Now this is when it removes the triglyceride and cholesterol and absorb it into its shell and fill its shelf, it then return back to the liver and pour that triglyceride and cholesterol into the liver. So in this way it decreases the formation of plaque and it is beneficial for us, right? So this was, I think, all about the anti-hyperlipidemic drugs. If you guys have any confusion, you can ask, and if you like my video, share it, subscribe it, and click the like button. Thanks for watching. Allah Hafiz for now.